at Mybreast. What we wanted to do is to create Harley Street quality at an affordable price. All the surgeons are all of the highest standard in terms of training. We work at private hospitals of the very highest standard. The doctor-patient relationship is the most important and most fundamental aspect of patient care. You will remain in the care of your doctor, of your surgeon, and this is lifetime if necessary.
An abdominoplasty is an operation to improve the appearance and sometimes the function of the abdomen. It is not an operation for someone who is clinically obese. It's also unwise if you have a tendency in the family to produce blood clots, or if you've produced one before. It is also very unwise for smokers, as this also increases the risk of blood clots and can result in delays in wound healing itself. It really is extremely important for anyone considering an abdominoplasty to have a thorough and professional medical evaluation as to whether the procedure is safe for them. There is a difference between so-called mini abdominoplasty and a full abdominoplasty. A mini abdominoplasty can be very small indeed and may just involve the removal of excess skin from the lower abdomen. That does, however, still produce a scar, and the scar is not so very different from a full abdominoplasty. However, with a mini abdominoplasty, there's almost never a need to make a cut around the tummy button. A full abdominoplasty, however, usually involves not just taking away excess skin, but also removing excess fat and repairing the muscles. And it's that muscle repair that is the major distinction between the two procedures. The procedure of abdominoplasty is always carried out under a general anaesthetic. The scar is low down in the abdomen, usually just above the pubic hairline. The incisions are designed to follow in a natural crease, and they also follow the line of modern lingerie and swimwear. Because they sit in a natural crease, although the scar may look quite large when it's first done, they do tend to heal very well and fade after a period of many months. A full abdominoplasty can be painful. It's similar in many ways to hernia repair. And the reason for it being painful is that the muscles in the centre of the abdomen are put together. And muscles are susceptible to pain when you move them afterwards. During the operation itself, we actually inject a long-acting anaesthetic into the muscles, or the sheath around the muscles. And that usually is very, very good for 3 or 4 days of reducing the early pain in the abdomen. In terms of complications or side effects, abdominoplasty is very similar to any lower abdominal operation, like a caesarean section, in that there may be some numbness of the skin of the lower abdomen just above the pubic hairline. For most women, this actually recovers and is barely noticeable within a year. Recovery from abdominoplasty takes 2 weeks, and I think that no matter how fit or how young you are, that's almost a mandatory period of recovery. You won't be ill in that 2 weeks, and of course you will be able to walk around and do normal things, but you wouldn't be able to drive, and you certainly wouldn't be involved in any significant physical exercise. All patients having an abdominoplasty have a garment, a fitted abdominoplasty garment, which they need to wear for about 4 weeks. It does reduce pain. More importantly, it reduces swelling, and it also helps to let the new skin and the new shape of the abdomen heal in a nice, even way. Any woman having an abdominoplasty will need to see their surgeon on several occasions post-operatively. In the first 2 weeks, patients are reviewed to make sure that all the healing is progressing very well. It's also important that patients are seen at 3 months and 6 months after surgery. And indeed, at 6 months, it may be sometimes that some very minor revisional procedure needs to be carried out. The results of abdominoplasty are generally very good. They can often result in a huge increase in confidence and self-esteem, and practically they'll also make a big difference in that one may drop a dress size or two, or just be able to wear jeans or skirts much more comfortably. And I think that most women are delighted with the results of the procedure.